So it's almost the time, and I think we can start now. I welcome you all to today's webinar, which is a very, very important webinar, I should say that. And this is the first webinar regarding the people who are preparing for the MRCOG Part 2 coming July. And I welcome you all on board. And this is the kickoff and 6-month preparation strategy orientation webinar at Med Exam Expert Forum. So first of all, I would like to, I think you all know me, and here is a slight introduction about me. I have been working with the MRCOG candidate for a long period of the time, and I'm very enthusiastic to help the people who are preparing for MRCOG, specifically as an overseas candidates, because they are really lagging in certain things with which they are failing many times and spending their time, their efforts, everything. I have been associated with the college for a long period of the time. I have been their faculty member for the MRCOG Part 3 course, as well as the MRCOG OSCE examiner with the RCOG at the different centers. And I have been working with the MRCPI Ireland for their OSCE exam. And I worked as a long-term for the resident training program for Saudi board for MRCOG, MRCPI, as well as I have been selected as an international regional society for Saudi Arabia by the RCOG for 5 years. So I love to teach the people, and I have a special certification in medical education from Dundee, in addition to all my other qualifications. And I am so lucky to be with the Med Exam Expert at this forum, and through which I'm able to talk to such esteemed colleagues like all of you. So for today's webinar, there is a synopsis of this session, which is to understand what to understand the MRCOG Part 2 exam structure, as well as the marking system. Of course, among the candidates who are here and who are hearing me, there are a lot of people who are going through retake the exam. However, there are other people who are just starting. So this little part I left for them just to understand this exam and what is the structure, how the marking happens at the college. Then to follow a realistic and time-efficient 6-month study plan, because I have been asked many times what will be the time limitation through which we should be able to prepare the exam. This was a question I have been asked many times. So I put a slide for it to keeping in mind that I may be able to answer this question. Then to recognize the high yield exam topics. What are important topics which you should be very, the expert in all those topics. To develop the effective SBS and EMQ solving techniques. And I know that EMQs, they are the killing part of the exam. However, if you are having a strong backbone in terms of your preparation and then to catch the buzzwords, everybody can do the EMQ parts, and EMQ will be a piece of cake for them. And then to avoid, what are the common preparation mistakes which the candidates are doing and which should be avoided. So this is the synopsis of the session today: to understand, to follow, to recognize, to develop, and what to avoid. So we will see all of these things during this session today. First of all, we will also see the secrets, the study secrets, preparation secrets, SBS secrets, and EMQ secrets. I will also talk about it, what exactly the secrets are. So, starting from the MRCOG Part 2 exam. First of all, the congratulations to the candidates who passed their Part 1 exam. because MRCOG Part 2 is the real hurdle to go through the Part 3. Part 3 is not as difficult as that of the Part 2 exam. First of all, you should know what is your eligibility. In order to be eligible to sit the Part 2 exam, candidate must first have sat and passed the Part 1 exam, which you have already done. Then the candidate must also satisfy the eligibility requirement regarding the currency and attempts as stipulated in the exam regulations. So these two things you should be very well familiarized. Don't forget the beginners to read about the exam regulations. This is a very important part to read about. Then comes expression of interest. Expression of interest means that you are intending to book this exam. This is a new thing which the college has started for a couple of years now. It was not in our time, but now they have started it because there are a lot of the people who are attempting the Part 2 as well as Part 3. So they have decided to make an expression of interest. For an opportunity to book into available spaces on the next Part 2 exam, you should submit an expression of interest form within a specified deadline. The deadline is always written in the RCOG website. A candidate must submit a new expression of interest form ahead of each exam. For example, if you enter the exam and you have done already the expression of interest, you pass the exam very well. However, if you do not pass the exam, for the resit exam, you have to submit a new expression of interest, right? I think I'm clear about it. This is how the expression of interest form looks like. They are asking about your account number, like your registration number with the college, your email address, and please keep watch on the email. Whatever you are using, they will keep on sending you their correspondence on that email. And please do not forget to check your spam folders as well. Your first name, your second name, and all of this form should be submitted properly. So this is the form. Then comes the Part 2 exam, July 2026. What are the important dates? You can take a screenshot of it, although this is available on the RCOG website. The expression of interest closes on Tuesday, 24 March. Booking window application will open 21 April. Booking window will close on 2nd June 2026. Exam is on 1st July 2026. And the results will be declared after 28 days, which is 29 July. So these are the important dates. You should keep watch on these dates. And these are, this is the scan from where you can get the different places which are available as a QR code to see. There are so many centers available all over the world, 40 centers available in 50 plus countries. However, the situation is that the seats fill very fast. So you should be very quick for the expression of interest for your application as well. So then comes the fee. In Indian candidates, they have some additional fees and you can get an information about it. And the band A, B, and C, this is their corresponding fee. So you can also get these all slides. I have got it from the RCOG website directly. And you can see them there, or if you want to take a screenshot, you can. Then comes the questions. Over there on the website of the RCOG, there is a part which is called as Read the MRCOG Part 2 Frequently Asked Question. There are so many things which you are thinking about, and you can directly get the answers to those questions directly. And if you have any query, the RCOG has given you an email, which is this, exams@rcog.org.uk, or you can call them there, right? So you can get an information or whatever you like by this email. The question, how many times can I attempt the MRCOG Part 2 exam? The UK-based candidates who intend to enter the UK Specialist Register, they are permitted not more than 6 attempts at the MRCOG Part 2. But the candidates who wish to apply for the MRCOG Part 2 following the 6 previous failed attempts they have to provide some supporting documentation from their head of school or equivalent to tell them that there was some exceptional reason for permitting a further attempt at the exam. So this is for the UK-based candidates. And for the international candidate, there is no limit for the attempting MRCOG Part 2 exam. I'm talking about Part 2 exam. Now, you should understand the format of the exam. This is a computer-based testing examination, and the candidate must pass the MRCOG Part 2 before taking the MRCOG Part 3 exam. There are two papers which are computer-based papers, which are single best answers as well as extended matching question answers. And in between, there is a lunch break. The paper 1 counts for 50% of the marks, and paper 2 counts for 50% of the marks. So the total marks are 100 marks. Each paper consists of 2 types of the question, which you are already familiarized. However, the beginners should know they are SPAs 40%, EMQs 60%. The time schedule, paper 1 is 3 hours, 180 minutes, and the college allocates the 3 hours is up to you, whatever you people like to do. You want to do SPA first or you want to do EMQ first. But the college says that the 70 minutes you should spend on SPAs and 110 minutes on the EMQs. Me too as well. I am in the favor of the RCOG, that it is a right recommendation to spend little time on the SPAs, but much more time on the EMQs. As I said that the EMQs are really something which are very, very difficult part of this exam. But it depends upon the people, whatever you people want to do. This is your time, you can use it. Then there is a lunch break, and then comes a paper 2 with the similar time and the similar number of the questions. So here is a scoring system. As I said that SBAs are 40% and EMQs part is a 60% of the total exam. Here comes the real webinar and the real session today. The candidates who are appearing for the MRCOG Part 2, they are confused what you should do, what to read, from where to read. I tell you, there is no book actually to study for the MRCOG. Everything is on the internet, and everything is at the RCOG website. And you can just Google it and you can download all the things, whatever. So please take a picture of this part. You have to read Green Top Guidelines, NICE Guidelines, British Society for Gynecological Endoscopic Guidelines, BASH Guidelines, and Oncology Guidelines, Faculty of Sexual Reproductive Health Guidelines, Scientific Impact Papers, Consent Advices, the Obstetrician and Gynecologist, which is the RCOG itself, the journal, Embrace. So these are, Embrace is the maternal morbidity and the mortality report, which are the confidential reports about the maternal morbidity and the mortality. It is published. And you have to see the recent one as well as the latest, at least 3 to 4 Embrace. You should see their reports. That what is a leading cause and what are their recommendations and what they are doing about it. So these are all the important things which you have to memorize by heart in order to able to answer the college question during the exam. Syllabus. Syllabus, I tell you that you should rely only on those sources which are RCOG recommended resources. And the most important are the Green Top Guidelines, which is available at the RCOG website. Then comes the NICE guideline, National Institute of Clinical Excellency guidelines. What are the important guidelines and what are the key areas which you should master? We will see in a while. Then comes BASH guidelines, college EMQs and SBAs. This is available on the strategy. You can buy it. Then comes the FSRH guideline, and TOG articles, and very important, please don't forget to buy strategy because this is a must source. You will get a lot of things which you cannot get from here and there. Rather than consulting a book, consult strategy. Anyone who has a college number and you have the account, you can get it on certain payment and you can get the benefit of this. So this is the right syllabus which you have to go through, and whatever you want to study, you have to study from all of them and don't go here and there. So in the syllabus, there are 14 modules. And in the 14 modules, these are the important topics which are being covered. You can see that these are general clinical skills, which covers the consent, communication, examination, safety, teaching, appraisal, audit, teaching methods, core surgical skills, which is about the basic surgical procedures as well as suturing and asepsis, post-operative care, antenatal care, maternal medicine, management of the labor, delivery, postpartum issues, gynecological problems, subfertility, sexual reproductive health, early pregnancy care, and gynecological oncology. So the college has divided the part 2 as well as part 3 into the different modules, and these modules are 14 modules which have got these key topics, and you have to do the mastery in all of these key topics and the core topics in order to sit in the part 2 exam. Now coming towards the green top guideline. The 60% of the question, I tell you truly, they come from the green top guideline, and all of the green top guideline you have to memorize by heart. For example, I have just put one guideline here, which is assisted vaginal birth. And the good news is this is also available as an app. You can go through the app store on your mobiles and you can download it, the green top guideline by the college, and you can just walking and talking and you can read those guidelines. Anytime if you forget anything or any recommendation, just open your mobiles and you can see this. Bottom, diabetes in the pregnancy, hypertension in the pregnancy. And the red one, intrapartum care. You will get 100% questions from the intrapartum care related with the labor, related with the delivery, and related with the CTG. Postnatal and cesarean section guideline, induction of labor, preterm labor. You will get a lot of questions on the preterm labor regarding the assessment, regarding the cervical cerclage, fibronectins, and the magnesium sulfate, steroid, time to give, progesterone role. All of these, they will make a lot of questions from this guideline as an EMQ. Then comes the incontinence. You all know about the urinary incontinence, and you will again get multiple questions from the urinary incontinence. They will make a lot of the scenarios from the incontinence. And this time in the part 3, there was a graph they put in the MRCOG part 3. And one of the area was partogram as well. They put these two in the teaching stations. So when you are preparing for the part 2 in the we can say that you're also preparing for the part 3 as well at the same time. Then comes infertility and LARC. LARC is long-acting reversible contraception, and there is a full guideline about it, and you can read all of these, and there are many tables and also the many summaries as well. So these are the important guidelines from the NICE area. Here is the FSRH guideline, which is a Faculty of Sexual and Reproductive Health. This is usually about the contraception. In the contraception, you should know United Kingdom medical eligibility criteria. They will put a lot of question for you. Comes with the breast cancer, and she is demanding Mirena. She is demanding POP. She is demanding OCPs. So they will make a lot of the things to test your background knowledge, how you know. This is how they make the question. They want to see how safe you are. and how you tackle the different scenarios. Then come progesterone-only pills, oral contraceptive pills, implants, injectables, contraception in more than 40 years age group of the women, and the postpartum contraception. So these are the most important guidelines for the contraception, and you have to master in all of them. Then comes a TOG. TOG articles, people are telling you read 5 years TOG and 10 years TOG and the 3 years TOG. No, the ideal is to have at least the 3 years TOG of the last 3 years. These are very important, and in addition to them, you have to read some of the important subjects and the topics from the old TOG articles. What are these? They are the following one. So they are here. One is the infertility. Infertility, you will get assessment, surrogacy, ovarian hyperstimulation, hyperprolactinemia. This is from the TOG. In the surgery, abdominal wall incisions, uterine perforation, enhanced recovery program, nerve injuries, abdominal circulars. Nerve injuries, they will keep on asking. The patient has a foot drop after the pelvic surgery, endometriosis, and so which nerve has been involved? Also, not only part 1, but in the part 2 as well. Then comes oncology. Borderline ovarian tumors, they love it. Fertility sparing surgeries, they love it. BRCA genes, they love it. And then HRT and alternatives to HRT, which you have to read from the other TOG articles rather than only the last 3 years. This is in addition to the last 3 years. These are coming into the older TOG articles. Then comes the medical disorders in the pregnancy. Headache is very important. I think headache came in 2012 or 2014, something like this. So this was an old TOG article. However, the headache causes are very beautifully done in this article. Spinal cord injuries are very important. Ischemic heart disease, you will find it very beautifully written there. And eruptions in the pregnancy, they are very changes in eruptions. And sometimes they put a picture during the exam, or sometimes they just tell you the description. Then comes the postpartum urinary retention. This is also very important, and they can bring many questions from here. Appendicitis in the pregnancy, systemic lupus erythematosus, cystic fibrosis, asthma in pregnancy, liver disease, and bariatric surgery. They are important, very, very important. Bariatric surgery is very important. And there are a lot of the people who are coming in the clinic after the bariatric surgery and they are pregnant. So this is a beautifully written TOG article. It came in maybe 2016 or 2014. So you have to download it and you have to read about it. And polyhydramnios. You will not get a beautiful article other than the TOG about the polyhydramnios and its management. So these are all the important things which you have to understand, and you have to read them by heart, all of them. Now comes additionally, you have to see the scientific impact papers, consent, clinical governance, and the embrace, which is a maternal morbidity mortality, UK, and very important, keep watch on the RCOG website, anything which is coming new when you are preparing. Off and on, just check the RCOG website. Sometimes new guidelines are coming. They are updating the guidelines. Sometimes they are publishing some report. Sometimes they're publishing some concern. So please just keep watch when you are preparing for the exam on the RCOG website as well. So these are all the important things which you have to do. Then comes the books. Books are, as you know that, so these are the different types of the books. This is, for example, by John Duthie. This one is Andrew Caesar. And this is again by Janish Gupta. These are the important, and this is Plinkton, Andrea Plinkton. So these are all the books which are important. You can get an idea that how the questions are put in the exam and where you are in your preparation. You can, for example, if you make a wrong answer, there is nothing to be worried about. Just to see why you were wrong and where you were wrong, why you picked up the wrong option. Just see that, go back to your guideline, go back to your resource and read about it again. So these are the important things. These are the single best answers questions. And this is Brian McGowan. And this is again another book. And this is Andrew Caesar. And this one is Amanda Jones, is by the college itself. This is also very, very important. The college has published itself. This is a must-read book to get an idea how the SBAs are put. These are the books' names: Prabha Sena, Tahir Mahmood, Kalwani, Andrea Pillington, Janish Gupta, Rekha Vantakal, Amanda Jones. And I know that the people know about it who are preparing. However, the people who don't know, just you can have an idea that these are the books which you have to read and to master them. Then comes a recalls truth. There are the people who are coming and just doing the recalls and going for the exam. So I tell you one thing. Recalls are a good source just to get an idea how college thinks and how the college is putting the exam. College has got its EMQs, SBAs, as well as OSCE scenarios bank. And every year, every 6 months, they are updating it. So please do not just rely upon the recalls. Recalls are a good sort of the thing where you will get so as I said that, we will also see why the candidates fail. First of all, absence of a structured study plan. This is very important. They don't know that what to study, from where to study, and number two, how to study. They have all the material. I have seen the people, they don't know how to study a guideline and how to memorize the guideline. What are the important areas and what are the levels of the evidences which are given in the guideline. Guideline is written with the help of lot of people, lot of the scientific people who are putting their mind, and then they are searching through the database, and then they are putting their recommendations in those guidelines. And that's why every guideline is updated as well as off and on whenever there is a time. So you should know that what is a proper structured study plan before you go ahead. Then comes studying the theory without consistent SB and EMQ practice. Studying the theory is also not sufficient. So practicing the SB and EMQ is also as important as you study the theory. Then there are the people who neglect their weak areas. The people, for example, someone who is poor in oncology, they don't memorize the staging and the treatment options, as well as, for example, the infertility. Some people are poor in the infertility, or some people are poor in the contraception. They just ignore it and they think, might be it will not come in the exam. This is not the exam which is of undergraduate. Please remember, this is an international and this is a postgraduate exam. After this, you will get a license to be a safe doctor. So please think about that. If, for example, it will not come that area in the SBA, it will come in EMQ. Or if in both of these it will not come, it will come in part 3. So the college attest you in each and every part, in each and every subject. So if you feel any subject which is very difficult for you, there are the subjects, and we are all human beings. Sometimes some subjects we don't like to study, or we are weak in those subjects. But don't hate them and don't leave them. Don't neglect them. Just work hard on them. Give them time, seek help in those areas, and ask your seniors, ask the other people, and just study these subjects. Don't neglect them. Then comes the poor time management during the exam. The people, they start doing the EMQs, for example, and they are just for example, there is some difficult EMQ, you don't know the answer. Don't waste your time in that one difficult one. Just make a star with the pencil on that and move on to the next one. Once you finish all, just then come back towards those areas and those EMQs or those SBs where you have put a star with the pencil. Do them up to your best knowledge and then erase those star which you have put with the pencil. Star is just to put that so that you can remember in the hustle bustle of the exam. Just you will see the star and you will remember, yet this question is left and I need a little bit more time to think about. So the poor time management is also very important in spite of the good preparation. Last but not the least, burnout in the final preparation phase. People, they are burned out with the preparation and they are stressed out because we are all working and we have a lot of the commitments, the family commitments, our study commitments, our workplace commitments. So please don't burn out, because burnout will also kill your success. Okay, so you have to fight with as well. Burnout is a final preparation phase. I tell you, everybody can do it. Then comes an important slide, which is a 6-month planning for your exam. So divide your exam part in the 3 phases. The first 3 months, they are the foundation phase. You just build, read, and understand, and build your core understanding of the guidelines and of the topics. In the second phase, which is a 4 to 5 months, which is about 2 months, strengthen your SBAs and EMQ. Keep doing the SBAs and EMQ and revise. See your mistakes and revise. Just do the EMQs, SBAs, and revise. Then comes the last part, which is a 1 month before the exam, which is exam readiness part. And here the mock exams and the final polishing by some sources, as well as by attempting the mocks, by attempting the different questions. This is the part which is very, very important. How the med exam helps in this crucial 6-month time. How we come into this place in all of this part. Let's see that. What we do. We advise you how to read the guidelines smartly. Guideline is not like you open the book and you start A, B, and C, and D. No, you have to have the strategy and you have to learn how you read the guideline smartly. We teach you this thing during our lectures. Then we also tell you about how to study with the help of applying the new teaching methodologies in our teaching. Then we provide you a support by the WhatsApp Telegram group with daily activities with the help of our in-between the moderators who are in touch with you, and they are doing the daily activities from the different topics which we teach you. They are posting the questions, and we are also there on the back of our moderator, where we also check and we try to answer the queries which are there. So this is how we are in the picture in this journey to achieve success. Let's see the upcoming attractions and the upcoming courses which are for the MRCOG at the med exam in July 2026. So there will be a revival of the course content. We will revise all the course content and we will make it updated. I have also been involved in this, and we are doing a lot of the hard work to make the content as updated, not the older. We are revising the guidelines, we are revising the question, we are revising the lectures as well. We are doing the study group discussions and evolving the recalls. We are putting a high yield question discussion that the people can get an idea that how the questions which are very important, they can come from the exam, and how to answer them, how to understand them. MRCOG at MedExam has got the 4 basic products, which is a regular course, a crash course, exam question bootcamp, and EMQ bootcamp. We all have the meeting, and we have all worked on it, and we have decided to launch all of this because we felt that EMQ is also a part where you people feel a lot of the difficulty. So we have decided to make an EMQ bootcamp, exam question bootcamp. Crash courses and regular courses are already there. And we will also add some new things as well. So the new additions which were there, they are here. You will see that there are the mentors, moderators, complete live session schedule will be there, and it will be shared with you people. There will be the 3 groups: main study group, high yield question group, question bank topic wise, channel of MRCOG part 2 July 26 queries with the name of this. And there is LMS content in which you will get the summaries of all the guidelines, topic test, question banks, recordings of old batch. For example, whatever I'm teaching, they're recording it. They will also put it in that in your learning management system. And you, the people who cannot attend it because of their commitments, they can also hear that. And the PDF of the recalls, and then the final mock exam will also be there. This is a new edition, and Mega Booster, where all your mentors will be there in the last part to answer all your queries. So these are all the new beautiful attractions which are coming with the Med Exam Expert. And here is this was about the regular course, which I told you, regular course. And now we're coming across to the crash course. The provisional date will be the 1st May. However, the date can be up and down depending upon the situation. However, this is the date. Here again, you will get the different content in the LMS, as well as we will also share the PDFs of the recall, final mock exam, and mega boosters for this as well. So this will be a crash course. New edition will be the MRCOG Part 2 Exam Question Bootcamp, which will be usually from 8th to 13th June before the exam. And the EMQ Bootcamp will be from 15 to 20 Junes. And the recalls will be, in addition to the recalls, we will be adding high yield questions which are suspected to come in the exam as well. So you will practice them, these questions. This is the provisional sort of the schedule, which is July 2026. The first session we are having it today. And then the Urogynecology Hassan will take, and similarly, the other parts, core surgical, he will take. I will take the obstetrical emergencies. I am working hard on it. And I'm putting a lot of the guidelines and everything which are important, and how to tackle the questions. And we are also planning to add some questions as well at the end of each session, which you can practice, and you can get an idea that how the examiners are thinking and how the questions are being put from that particular area. This is also a new addition in the end of each lecture. Then I will be teaching you gynaecology in the 2 sessions, and similarly I will teach you clinical governance. This part I love it to teach because this is the most important part, and I have been attached with the clinical governance areas for a long period of the time in the hospital settings. So I will teach you in the real sense what the clinical governance is. This is a 2nd May coming, and you can see that how the people are there. And then biostatistic workshop is also there with the Desiree, and these are the people who will be teaching. Here are the mentors who will be teaching you, and you can see me here as well. And we will be there with the learning management system, with the Telegram, with the WhatsApp group, with you people, with the help of the moderators. Now, shortly, we will also see the errors by the candidates not doing the following. What the candidates do: reading the candidate instruction, they are not reading the candidate instructions properly. Make sure you understand the question. Application of the relevant knowledge, not the irrelevant knowledge. Concentrate on the buzzwords and the keywords. These are the things which the candidates don't do, but you should do these things. Then comes the tips. Tips, I know all the people, they love to take the tips. The tip is, first of all, read the question properly. Don't be panicky. Learn to catch the buzzwords and the keywords in the question, what they are asking. It is about the management. Is it about the diagnosis? Is it about the history? Is it where I am? The candidate is in the emergency room. The candidate is in a teaching session. The candidate is in a clinic. Candidate is in the theater. Where you are. Just think about yourself. Where they are thinking you are. Learn the techniques to attempt by practicing, then revise. But remember, revise wisely. So I have highlighted it. Now I promised I will tell you the secrets of the SPS. Read the question stem very carefully. Identify the key clinical clues. Secondly, identify the correct answer. If you got it, brilliant, very good. Go through it. Still, just tick mark it, but still go through the rest of option. Don't just, if you get the right answer, do not forget to go through the rest of the options. Sometimes that answer which you are thinking is not the right one. The answer is in some other lines. Eliminate clearly the incorrect options first, and then watch for the absolute term. There is never and always, they are not the things. Never and always never happens in the medicine, as you all know. One day or the other, you will always see the atypical cases. EMQ tips. Read the question stem first. Think of an answer. Do not look at the option list. Think about that if this is a scenario, what could be the answer? Ask yourself. Then read the stem, after reading the stem, think about, and then you go through the rest of the options. Try to find out your answer amongst the stem, what you thought. Now try to find it out in the area below. Then read the rest of the options before answering. So this is the tip for the EMQs. Here comes the question and answer session. So before question and answer session, I would say that I would like to tell you your success formula. So the success formula is smart revision by authentic and trusted resources. And med exam is full of the examiners, which are the real RCOG examiners, and we are all expert in our field. So you can rely upon the med exam. Secondly, guideline mastery, and then calm execution. So this is your success formula. Okay, so this is the time to have the question and answer session.
Ma'am, can we get a drive or some other source where we could get all the guidelines in one place?
Actually, this is not the proper, there is no such one place, but you can make it at one place. And might be the med exam has got all the guidelines in one place. In the real sense, it is to be done by the candidate. Just download them and you can do them by yourself. But there is no one source where all the guidelines are there.
Thank you, ma'am.
Excuse me, ma'am. I was a member of the course since last 6 months for the MRCOG-2, and I had my exam on Thursday, and now I'm waiting for the result. But the course is starting on 17 January. Oh, sorry, on 21st January. When it start?
21st January. Yeah.
21st January. Yeah. But I mean that can I join to the live sessions without payment, or should I pay? Because I have to know. I'm not sure I will pass or not pass.
Najla, I hope so you will pass. But in the med exam, you have already taken the course, and I don't think that they will give you the access with the same fee. Because you know, the people who are working for the med exam, they are also paying to them. So I don't think that there is such a thing up to my knowledge. However, you can ask the admin about it. But my knowledge is that you won't be able to access the live courses without the payment.
Sorry, can I ask a question, Dr. Yasmeen, please?
Yes, please, Adil.
Yeah. Thank you very much. I really appreciate. Thank you so much for the very valuable information. I was just wondering, I missed out on that piece of the Green Top guidelines. Do we go to the mobile app and we can download it from there? Because I was looking and I couldn't find it. Maybe I made a mistake. Thank you.
Adil, if you go through, try to do it by your app store, that RCOG, and from there you can download it. However, if you are unable, again, go to the RCOG website. There is a link over there for the Androids as well as for the iPhone.
Okay. Okay.
You can
it's
100%
for free?
download it. I have already downloaded in my mobile.
Good. It's free,
Yeah.
right? It's free. Yeah, all right.
Yeah, it's free. It's free. The only thing, before it was coming directly from there, but now it is coming through the BJOG. They are through the BJOG. They are publishing in the BJOG as well. This is the only thing. And the beauty of the new guidelines, which they are doing. Yes, please.
Ma'am, I've tried searching for the app, but I'm not able to find it. I've searched both words, Green Top and GTG guidelines. So what exactly do I need to search there?
Just go through the RCOG website and you can find it out there in the Green Top guidelines.
Okay.
If you go through the Green Top, you can write there, how can I access the Green Top guideline on the mobile app? Just write this question. They will give you a link and they will let you know.
Dr. Yasmeen, I have one more. Sorry, I have one more question, please. Once
yes,
again,
please, Adil, you are welcome. We are here to answer.
Yeah. You did not mention something about notes taking. I mean, sometimes, while seeing the live lectures, there's very valuable, like every piece of information is very valuable and you feel like compelled to take notes and so forth. Do you advise that mode of studying or like, I mean, it depends, I think, from person to person, but what's your general take on that? So notes and all that,
Adil, I have been with the medical education for the long period of the time. And I have seen that every person is different in the retention of the knowledge. For me, for example, I'm a person I retain by listening, by hearing. Yes. But there are the people who just write and then they retain. So whatever the type of the personality you are, it's okay in any way. Don't just think your friend is getting like this, why you are not getting like this. No, you are a different person. Your brother and sisters are a different person. So just concentrate. The only idea is we want all of you to gain knowledge and expertise to answer the question. It doesn't matter by whatever means you are getting it.
Thank you very much. Thank you.
Yeah. Yes. Further question, please.
Madam, 5 months are enough for preparation?
This depends upon the people. For me, 6 months is a formula and 5 months and 6 months is not, too far. But you have to be a little bit more faster than, I would say that.
All right.
Ma'am, how many attempts totally?
As I said that the UK-based candidates, because they are being trained over there, they are given only 6 attempts. And for the 7th attempt, their supervisor and the deanery, they have to write special letter to the RCOG. But for the international candidates, there is no limit of the attempts.
Okay, ma'am. Thank you.
For part 2 only. But for part 3, yes, there is a limitation of the attempts. But for part 2, there is no.
Ma'am, what is the passing criteria?
You are asking me the secret now. The passing criteria. Actually, when the questions are made at the college, there is a lot of the things which are taken into account. There is a question bank, and from the question bank, the questions are selected. And then there is already in the computer, the exam answers are fed over there. The most important passing criteria is the patient safety. If you are safe, you are with the guidelines, you are evidence-based, this is the real criteria, I tell you.
All right. Thank you.
Zainab, actually, for example, we do so many things in our clinical practice. I know you are all practicing, mashallah, and I'm also practicing. We do so many things in our practice which is not written in the guidelines. But the college does not want what you do. College want what is an international level, what is by the guidelines, what is by the evidence-based. This is what they want.
All right. Thank you so much.
Any other question?
Yes, Dr. Yasmeen, I got some books not too long ago, past exam papers like recalls, Fath al-Rahman. I got them. Somebody sent them to me from abroad. So, like, it's worth going through them, right? I mean, they won't hurt in terms of after everything you said today. Yeah.
I think I tried when I made this session lecture. I tried to put all those things, those queries which I was expecting the people will ask me. Because for me, when you prepare a lecture or something, you should always see to whom you are going to address and what are their concerns. This is what I told you, the recall truth. There are the people who are selling their products with the name of recalls, and they're telling you this is 100% and this and that. I tell you, Adil, there is no shortcut for the success. Specifically for these international level exam, don't spend your money and don't waste your time until or unless you really understand the exam, you are very well prepared, and you know the techniques, tips and tricks. Then go to the exam.
Thank you very much. That's very informative. Thank you. Yeah.
Yes.
Yeah. Wonderful.
Madam,
Yes,
don't you
Zainab.
think books are outdated?
These books, your question is very right, Zainab. Very nice question. Actually, the books which are written, they are updated. However, there are old books where you will find certain questions which are old, but most of the questions they are making updated. I did not say that you will get all the questions from here. I said just practice them and see. And if you find any question which is outdated, don't do that. However, most of the time, the writers who are writing them, they make them updated.
Actually, I have given one read, and
Okay.
it's about the answers.
Okay. You have given what?
Hello?
Sorry, can you repeat?
Hello?
Hello. Yes, Zanam, I'm here. Tell me. Hello, we can hear you.
Hello?
Hello, I can hear you, please. Tell me. Hello. Adil, can you hear me?
I can hear you very well. I can hear you perfectly. Yeah.
Okay, great.
I think
So
Zainab
I think there is something wrong with Zainab. We will wait for her question again till she gets in touch with us. And please ask the questions. We are here before we go ahead to our further sessions. Ask the questions, please.
Ma'am, I
Yeah,
found
this
the
is
guidelines that you said. Hello?
sorry.
Yeah,
Yes.
ma'am, I've actually found the Green Top guidelines on the website. I wanted to ask you if we have to learn by heart like all of these guidelines, the Green Top ones that are mentioned there.
Yes. What is your name, doctor?
Ma'am, Rutab.
Rutab. Rutab, actually, I told you there is a way to study the guideline. Nobody can memorize each and every word of the guideline. This is what I
Yes,
said.
ma'am.
You have to memorize the important parts of the guideline by heart, the applicable. And this is what I was talking about when somebody asked the question. I forgot to continue from that. That the beauty of all the new guidelines which the college is publishing is that they are making the summaries in the beginning as well. This is also a beauty, although they are very long, but they are making the summaries as well in the beginning. This is of great help. And on the top of it, all the mentors at the med exam, we are teaching you during the live sessions how to read the guidelines and what are the important areas where you have to concentrate. And we are also putting the important summaries in the LMS system, which you can access. And also in the live sessions, we are putting during our lectures all the important flow charts, tables, and important things which can come in the exam. So this is what we are doing. So from there, you can get an idea that how to read a guideline.
Thank you, ma'am.
Dr. Yasmeen, this is actually not a question, but just something I observed. I picked up a few questions from some of these books that you've mentioned, that you've posted, and in certain exams, some questions were exactly the same. Like a few questions were from these books, actually. One or two or three questions that I picked, just as a comment. I don't know.
Yeah, this happens by chance because some of those people who are the writer, they are also affiliated with the college as well. So they are
Okay.
the one who are, yeah, sometimes it can happen, or sometimes it can be by chance. For example, they can change the value. For example, they can make the extended breach to flex breach like this. So
Gotcha.
to read those books, is to get an idea that how the question comes, how you
Yes.
answer, and how you go wrong, and how you will get correction. This is the basic idea. It doesn't mean that this is the question of this exam, and these are the books which are for the exam, and the question will come from there. No. You will get an idea how the questions are put. This is for your practice only. This is not to memorize them for your exam. Just do them. Do not look into the answer. Have your answer. Hide the answer. Then look into the answer. And good, if you get it right, very good. Even if you are right, read the answer. Why you were right. Okay. And if you are wrong,
Yes.
okay, no problem. For example, there was some question about the DVT. Your scoring was 3, but the answer is 4. Scoring is 4. So now you will
Yeah.
come to know where you were wrong. You will go back, you will read that explanation, then you will go back to the DVT guideline. You will see the scoring, remember that table in the orange, yellow, and red?
Yep.
That what is how the scoring is made. So you will get again, you will revise it again. This is an idea.
Gotcha. Yep. Thank you so much.
Yes, Dr. Aruj, please.
Assalamu alaikum, ma'am. Ma'am, I'm an
Walaikum.
old student and I have appeared in this 15 January exam. I want to highlight a couple of things and the things I was disappointed in my preparation for the MAT exam. I have an old student. First of all, the paper was absolutely new, absolutely zero recalls. Hardly, I think, 10 or 15% recalls were there. Although Dr. Rupam and Dr. Shiba have been saying all along that you have to build your concept and everything, but the questions like Manjaro and infertility and subfertility, that how many centers should be there, 15 centers or 30 centers, was not covered in the course. We totally rely. Now, I'm a working consultant gynecologist. I have 3 kids. I totally rely on your course. I totally rely on the material you have provided, which is obsolete. Secondly, these workshops, as you have been stating, the CTG and EMQ and everything, all the questions were repeated from the January attempt 25, from the July attempt 25.
all the questions. There were no new questions whatsoever. And the exam now I feel is like a trickery. The options are so close to 4, 6, 8, 10 that you need to know the absolute answer. You just cannot, you cannot make an educated guess. So I would request the med exam team to update their question banks. And another thing, madam, I want to contribute, or I would suggest this progressive thing, this irregular thing, this workshop, this boot camp, it is too much. We have 4 groups. We have a regular group, we have a progressive group, we have a boot camp. It is too much, ma'am. We cannot do this. We are all doctors, we are all professionals, so we need to have a professional approach towards the exam. You tell me, ma'am, how we manage 4 groups, Telegram, LMS, live lectures. Matlab, this is too much, and this is humanly not possible to cover everything in single day. And we lag behind. The questions keep piling up. You get confused, and you are not at par with the preparation, and then you lose it all. This is my suggestion and my partner.
Aruj, I tell you one thing. Regarding the MRCOG Part 2 exam, is not a piece of cake in the real sense, number one. Number two, nobody can study on your behalf, and nobody can give you like 100 out of 100. Regarding the med exam, the things are always being updated on the quarterly basis, 6 monthly basis. We are really struggling hard to rewrite all the materials, and we are 100% working on it. But to take this exam, I should say that you should ask yourself whether you can do with all of these commitments or no, number one. Number two, how is your clinical commitment? Number three, how is your family situation? Then you should go ahead it. This exam is not, as I said, that is not a butter. This demands a lot of the hard work from the candidate part as well. And most of the candidates, they will agree with me. So just to, if you do not pass the exam and saying that it was the fault of this and that is not the right thing. Actually, you should work where you were wrong and then try again, right? The people who are conducting the courses, including the med exam, they are doing their best, what they can provide. But ultimately, you are the one going to the exam. You are the one tackling the question. You are the one to understand. This is the thing. I would say that.
Ma'am, I totally understand that it is an immense and huge basin of knowledge. There are talks, there are scientific impact papers, new developments. We don't read books anymore. Books are obsolete. Let it be Dewhurst, Shaw's, High Risk, they are obsolete. So many things have changed over the period of time. Even in I'm working as a consultant gynecologist for the last 10 years. From the time we were using the Pinard fetoscope until this Doppler and CTG, continuous electronic fetal monitoring, so much has changed. So we are relying on you. What is the point of joining this course if you cannot guide us in the right direction? We have the knowledge, we are practicing, we are doing everything. We just want to be updated. We just want to be on the right course and right track. So the practicing material is out of date. Things are out of date. You have to make us at par, ma'am. We rely on you for your guidance, for your mentorship. If we had to do it ourselves, then what is the point of joining the course?
Aruj, I understand your stress and everything, but this is not the right way to just blame to someone. Of course, the people who are studying with the med exam, there are so many success stories as well. So I would again say there is no course in the world or in the sky which can give you 100%. Ultimately, this is the responsibility of the candidate to know the things and to do it. So before you go ahead, this is not something you can do. This is not a sort of FCPS or MCPS which you can do, and even the people are doing without going through the different things. This is an evidence based, and we are also giving you our best, what we can do, but ultimately you have to put your effort. This is my suggestion. And the things are not outdated. I know that. I have gone through all of the material, and we are updating many questions as well as the guidelines and the summaries. I think there is no other platform where to such an extensive work has been done. And we are the real examiners in the college, me and Hassan. And in so many exams, we are together. And we also pass the exam together as well. So I have seen there is a lot of the hard work on the LMS, which have been done, that you are having the groups, you are having the live sessions, you are having the recordings. You have to concentrate, I should say that. Rather than blaming to the other people, we should see where we are. And there we should take our fault and we should correct. Any other question, please?
Excuse me, ma'am.
Yes, please.
Ma'am, I'm Dr. Samina. This is my extension of the course because I have to appear in July. And I really appreciate the EMAT team because they have very accurate keys of answer, and that's why I got the extension. But I want to add something that, ma'am, if we find some recall key that we can't accept that, there should be some Telegram group other than the Premier group, that so we can discuss that problem in that group, separate group, so we can get right answer. There should be some mentor in that group. Yes, ma'am.
Oh, I will convey this to
Otherwise, it's an excellent team, ma'am, because I have to appear in July, but I take the course of January, and it's excellent. I really appreciate all the dedicated team, and ma'am Rupam, all is very well, very nice team. But sometime the problem I face that when I found some recalls that which I can't agree or I can't understand. Basically, the student really not understand, then the mentor adds some evidence, some lines. That's why they tell the candidate that this is the answer, this is the evidence, this is the reference.
Okay, we will do that. No problem. I will convey it, and the experts are also with me. They are also taking the note of this.
Yes, ma'am.
So yes, ma'am. I also agree with Dr. Samina. This could be very helpful if this could happen. Thank you, ma'am.
Of course, we will do that. Any other question? No question? Okay, still you can ask me the question.
How many of your course students passed the exam last time?
How many? Sorry?
Of your course students passed the exam.
I think Anam and Sabah, they are the one, and they are here, they can answer. I don't have an idea because I recently joined them.
I passed MRCOG-1 with your course.
Okay. No,
yeah,
there are a lot of people.
I was in MRCOG-1 with this course, and I passed MRCOG-1, and now I am trying for MRCOG-2 for mid exam. Yeah, this is very nice course. I
am
love
asking
it.
about no, I am asking about part 2.
I exactly don't have an idea because I recently joined med exam, and I think the med exam team can answer it.
Can I ask a question?
Yes, please, Imani.
So what's the maximum duration between a passing part 1 and part 2? How many years? Maximum duration?
Maximum duration depends. There are the different types of the candidates and different types of the scenarios which happen. For example, there are the people who are already at the senior level, and now they think, okay, let's do the MRCOG. So they do the part 1. So you can attempt the coming next part 2. This is up to you. But you have to give them your evaluation for your training. This is what they are asking you. the evaluation of assessment of the training they want from you. If you have already done the training, even before passing the part 1, you can send it that to the exam, this RCOG. And there are the people who just pass the part 1. They have just done their house job or 1 year of their sort of the clinicalship, and then they're thinking, let's pass the part 1. They pass the part 1. To pass the part 2, you have to have certain years of the experience, at least 1 to 2 years for your experience to go through the part 2. In the UK, this is usually ST5 level. They can go through ST3, ST4, and ST5. From the 3rd year, they can go and they can pass the part 2 exam. But the part 3 exam, it happens at ST5 level. So this is how it happens. Everybody is different. If you have already certain years of experience, 2 years at least, you can go through part 1 and then immediately part 2. However, if you have taken part 1 now, take some years of the experience, then go for the part 2. This is how the things go on.
Excuse me, ma'am. Can we apply for an, for example, to take and have an experience inside NHS? NHS give us this opportunity after passing the part 1 to go inside the hospital just for observation and have the experience. How do they work? Do we have this
Actually, they are giving certain people who are eligible for that to go to the NHS and to have the observership. There are the certain countries where they are immigration sort of the things. They are giving them the opportunity to come and do that. But you cannot do the practice until or unless you have the GMC, which is General Medical Council, and you have the registration with it. Just passing the part 1 and going to the NHS to work is not possible. You can work there after passing. Yeah, if you want to just go for the observership, you have to apply through the immigration status. This is the only way to go there and to have the observership. Or
I'm inside the UK. I'm inside the UK. I'm inside the UK.
You can go there. You can go in certain hospitals just as an observership. You can go there.
Okay, thank you.
You can go to certain hospital in your vicinity and just tell them that I'm this and this, and I just want to have an observership for the 6-month time. For example, 3-month time. Yeah.
Yeah. Thank you.
Yeah.
And also, ma'am, I think should we study the books as well beside the course, or course is enough?
This is what I said. Dr. Arooj was saying that this thing happened and that thing happened. This is what I said, that you are the only one responsible for your success. The courses, whatever course, med exam or any other course, we are here just to help you, to give you a right direction. Rather than you are deviating to the right and left, we are putting you on the proper straight path. This is the only thing which we can tell you, that this is the right way to study and to do. But you are the one ultimately to study hard and to do that. There is no other books, and there is no all alone, stand alone course which you should rely upon. You should, as I told you, the right material. I specifically included the things in this session just to tell you that how you should take your preparation and how you start your preparation. And you should see, as I said, that the 6-month time is enough. However, every person is different. You should see your situation, your personal situation, your family situation, your work situation, how much time you can put into this. Then you should decide and understand this exam before you go ahead. Understand this exam.
So I think the course material is enough. Still, I don't know, should we buy the books or not?
Which books you are talking about? There is no books for the study. You have the guidelines which are available on the websites. Which books you want to buy?
The books that
These are the
you
only
showed us
books.
before.
Yeah, those books are only the EMQs and single best answers, just to practice from there, just to get an idea. There is no, in the real sense, theory books. I'm talking about the theory books.
Okay, yeah, thank you.
Yeah. When you will read all the guidelines and everything, you are exam ready. Then you can just go through them and practice, and you can brush up your knowledge and brush up your preparation.
Yeah. Okay, thank you.
Dr. Yasmeen, one last
very
thing, please, if you don't mind. I would like to
Yes,
request
please. No, I'm here.
Thank you. The course is wonderful. Thank you very much. I'm very grateful. Just once in a while, during the lectures, if you could also navigate us through the different parts of the course, like check the certain subheadings on the course itself. I think they have some certain things like flashcards. I don't know. Sometimes we're not very familiar with those. We go to the live sessions and we're focusing on that. Then we go to the MCQ, the groups on the Telegram.
Do that.
But yeah, we might miss out on some good source of information on the website, on the course LMS system. Yeah. Thank you very much.
No problem. No problem. No problem. We will do that.
Also, ma'am,
100%.
could someone please guide us about like how to access things on the RCOG website? Like you just told me about the GTG, and then it got very easy. I want to know how to access the latest TOG articles because I'm having trouble with that. Like the latest issues from the last year.
Yeah, on the TOG articles, they have restricted access. Being a college member, we have the access to the BJOG as well as to the TOG. But the people who want to access it, there are two ways. Either one way is strategy. If you will buy the strategy, you will get an access to the TOG article as well as BJOG articles as well. However, if you don't want that, you can ask your friends. Sometimes they can have it. Or in the other way, you have to pay and then you can buy, because they are restricted, the TOG articles.
Thank you, ma'am.
Yeah. So you don't know how the research goes on and how they restrict their articles. You will come to know later on.
Yes, ma'am.
Okay. Innocent questions. Okay, any other question, please? So the last one slide I have, I always put in my lectures and in my sessions, the take-home message. Either I teach the undergraduates or postgraduates, I always put one slide, the take-home message, which I love to. The take-home message is, in the MRCOG part 2, consistency beats the intensity. You have to be consistent. Okay, you have to be consistent. Keep going. Then number 2 is guideline-based preparation is the key. Guideline-based, evidence-based preparation is the key. Then comes every mistake is a learning opportunity. Every mistake is a learning opportunity. And remember, you can pass MRCOG Part 2 at Med-Exam Experts with the right strategy without stress. This is the take-home message for today. And this is the last slide, the most important. Keep going, aim high. Keep going and going and going. This is the last slide, which I should say, that keep going. And thank you, everybody, for joining today.
Thank you. Thank you very much. Thank you so much.
Thank you, ma'am. Thank you. It was very interesting.
So you can tell me anything else which you want to add or you want to ask. You are welcome.
We just want to pass the exam. That's the most important.
You will. You will.
Thank you, everyone. Yeah. So, thank you.
Yeah. Yes, somebody asked me, Dr. Aisha, I can see the chat now. You told 6 months time for the preparation. This time is with job or without job? 6 months are enough, she asked me. Aisha, I told you only the 6 month is not like I have given you an evidence. As I told you, everybody is different. Every person is different. Every person's scenarios and the family dynamics and the work dynamics are different. So you have to tailor. This is, of course, there are the people who can do within 6 months with the job, with the kids, with home, with everything. But there are the people who cannot even prepare for 1 year. Everybody is different. This is the motivation. This is from your insight. This is how you understand this. There are the lot of the things which is, but as I said that in the end of my slide, that consistency is very, very important. Keep going, and then aim high. You can pass it.
Ma'am, one question.
Yes, please.
Ma'am, the overseas students who pass the complete MRCOG, should they need that they should register themselves with the consul, or it's not needed?
With the consul, you mean GMC?
Yes, ma'am.
I think in some of my session, I will put the training, how the training happens in the NHS. Regarding the GMC consul registration, this is not like this. First of all, you have to pass part 1, part 2, part 3. Then you have to pass the English exam. And then you have to register with the GMC. You don't need to register for passing the part 2 or part 3. This is totally a different thing. GMC is different, RCOG is different. The GMC asks you to bring some evidence that we can register you. And the RCOG exam is the one which gives you an evidence that this is your certificate, that you are certified doctor by the RCOG. And then you go to the GMC, you pass the this English language test, IELTS, or some other English language test. They have on their website the different options. Then you combine these two, you go there for the interview, and then they register you. This is the way. You don't need to do the registration with the GMC before passing your all parts of the MRCOG exam.
Right, ma'am. It's necessary for job only. Registration.
Yes. Yeah, this is a licensing body. GMC is a licensing body. You pass the MRCOG, you keep the degree with you wherever in the world you are, it doesn't matter. And if you go to the UK, you want to practice there, they want you to have the license to touch their patient, to practice. For that, you have to have the license from the GMC.
Right, ma'am. One more question. Sometime, ma'am, the new guideline came and the two answer are different. Like the CTG in less risky cases of thin meconium, we will do in previous guideline. They say that intermittent like fetal heart, intermittent auscultation. But in new guideline, you will do it continuous. Ma'am, how we will guess that what answer will be correct in this key?
The updated one. Always, this is what I said, that always keep watch on the RCOG website, NICE website, what is coming new, because they are not the one. The guideline is being produced in 2008, and this will keep on going. No, you will see that if you see the guideline, there is an area, the first part of the first time it was published in 2015, and this is the second updated guideline. Okay, the second updated version of the guideline. When
Ma'am, some mentor said that if the guideline is before 6 months of your exam, then you will quote the updated. If it is within the 6 months, then you will quote the previous guideline answer.
This is what I'm going to tell you. The college, for example, you are going to the exam in July and the guideline comes in June. Most likely this question will not come. You will answer the question from the previous guideline, from the last guideline. The college will not put question from that. College understand it, that this is the one. They understand it.
Ma'am, how many months before you people made the paper? How many months?
At least 6 months. 6 months.
Okay, ma'am. Okay. Thank you, ma'am.
So don't worry, just concentrate on your preparation, concentrate on your weak areas, concentrate to try to understand the exam.
Ma'am, I have at the clinical. Hello, ma'am.
Yes, please, Ramaya.
Ma'am, I have seen that the clinical governance is the most weak area. Like when we read the recalls, like the trainee do the practice by this emergency. These are the weak area, ma'am. Can you please take a session about this, because we overseas students don't know about these all governance. That's why we have no the idea what will be the correct answer. There are so many recalls that we see that we don't know the answer, and we don't have any talk article or any guideline where we should read and have the answer, especially the story of teaching, what will be the way of teaching, and the if there is some complaint, if there is some endemic pandemic, where the complaint should go, or where who will manage this. These things are deficit in our teaching.
You are absolutely right, doctor. Actually, clinical governance is the part which the people don't understand as an overseas candidate. And clinical governance, you don't understand why, because you are not working in the NHS. They are doing it day-to-day practice, and their candidates know it by heart. Like there is by default, they know it. They don't need to know it. They know it because this is being practiced over there. For example, if you are working in some place, you know how the medical superintendent will take from here the complaint and these things. The similar goes on with the NHS. For the overseas candidate, this is the biggest part for the failure. There are few things which are important, which are the research part. What are the different types of the research methodologies, how the research is done, what are the different studies, what is the meta-analysis, what is the systematic reviews. This is very important. Then from the quality, from the audit, from the clinical governance itself is a big topic, and it has its own areas which need to be understood. So I asked the med exam to give me this topic, and I will take this topic myself. Don't worry, you will get it.
Good evening, ma'am. Ma'am, can I ask you a question?
Yes, please.
See, actually, I have attempted for 4 times. Within how many years? I'm an Indian. So within how many years part 2 can be completed?
Part 2 can be completed in how many years?
Yeah, is there a stipulated time limit for passing the MRCOG part 2?
No. For the international candidate, there is no. You can have so many attempts. But for the UK candidates, only 6 attempts.
No, is there any time limit? I want to know.
No. There is no time limit.
Thank you so much, ma'am.
This is up to you.
Thank you.
Yeah. Yes, Ikra, should we conclude the session?
Yes, I think we covered almost everything. Thank you.
I would say that don't lose hope and don't lose your heart. Okay, you will get it. Don't worry.
Thank you very
and
much.
don't be panic. Don't be panic, and just believe on yourself. You just need a little more effort, and first sit down one day and try to understand and try to see your situation, where I am, what I need to do, understand the exam, and one day you will get it. Like I got it, you will also get it.
Thank you. Thank you very much. Thank you.
Target is not far away. Keep going.
God bless you. Thank you. That's fantastic. Yeah, very encouraging.
Don't worry. Don't worry. You are very
Thank you.
near. Okay.
Thank you. Bye.
So I wish you
Sure.
all the good luck and see you in the next upcoming my session. It will be on obstetrical emergencies. Somebody is asking me, Safa, how many hours for study every day? Safa, it doesn't matter how many hours you study. I should say that you should have a quality study. Even if you study 2 hours a day and you study a quality, this will be enough. And if you study 16 hours a day, and this is just the quantity, not the quality, not the targeted, it is useless.
The obstetric emergencies, your session, Dr. Yasmeen, is coming up soon, right? I think.
Yeah. I think it is on 21st of February or something like this.
Okay. Beautiful.
I'm putting my guidelines on it. I'm working on it.
Perfect. Okay.
Yeah. We will put the updated ones. Don't worry.
Thanks.
Okay. Goodbye, everyone.
Goodbye.
Goodbye.
Thank you.
Thank you, everyone.